Visual acuity is the spatial resolving capacity of the visual system. It also expresses the angular size of the smallest target at the nodal point that can just be resolved by the patient. Dr. Harman Snellen, a Dutch ophthalmologist, proposed his optotypes in 1862, which are still being used widely during clinical refraction. The Snellen letters were so constructed that their constituent parts like limbs and spaces between them subtends an angle of 1 minute of arc at a specified distance. In United States, the distance is expressed in feet and the clinician uses the Snellen's fraction with 20 feet as numerator. In most other countries, metric unit is more popular, with 6 meter being the common test distance. On Snellen test chart, 6 by 6 or 20 by 20 letter size subtends an angle of 5 minutes of arc which has a letter size of 8.75 mm. A visual acuity score of 6 by 60 implies that the test is done at 6 meter and the denominator present the size of the smallest letter that is being read would subtend an angle of 5 minutes of arc at a distance of 60 meter. The angular size of such letter at 6 meter is 50 minutes of arcade. 6 by 6 is being chosen as standard on the basis for being easy to recognize. The charts are often viewed directly. However, when the room dimensions do not permit the test distance, mirrors are used to lengthen the optical path from the chart to the patient's eye. The visual acuity is noted each eye separately by the clinician. The patient is asked to read out every single letter from the top of the projected chart till the smallest letter that the patient can recognize. The smallest letter read by the patient is noted in the denominator, and this denotes the visual acuity for the patient. Most often visual acuity is abbreviated as VA in the glasses prescription. If the patient is unable to read out the letter on the first line of the chart, the patient is asked to move closer to the chart till the position where he or she can recognize other multiple letters. The distance is noted and the numerator is mentioned as 5 meter, or 4 meter, or 3 meter, and so on. Many often patient has significant poor vision and unable to recognize the letter from 1 meter distance. In that case, the patient is asked to count the fingers of the clinician at certain feet away from the patient. If still the patient is unable to recognize the fingers at close to face, the bright illuminated light is thrown to the patient's eye to check the perception of light and then from different angles to grade the projection of rays. This is mentioned as PL positive and projection of rays as PR. Similar way, the near visual acuity is tested at a distance within arm's length at 40 centimeters. However, this distance can vary as per the individual needs. The size of the typeset used is specified in point units, which is widely used in the printing industry. 1 point is equal to 1 by 72nd of an inch. Times New Roman font is adopted as standard font for testing near vision. N6 is the smallest letter print size that can be read at distance of 40 centimeter.